Well, good morning, and thank you for joining us. Today, we're speaking to you from near the Tom Baker Cancer Center here in Calgary, one of our province's hubs of cancer care. And it's fitting to be here today during Cancer Awareness Month. It's April, of course, when Canadians from coast to coast come together to recognize the profound impact that cancer has on the lives of patients and of families. And almost everyone in the province has a connection to this disease, whether it's personally or whether it's through a loved one or a friend. And it touches so many, and its reach is growing. And today, an estimated 176,000 Albertans are living with cancer, and another 19,000 are newly diagnosed every year. And that's providing Albertans with the, We're, of course, providing Albertans with the most effective cancer treatments because that is critical. And so today, I'm delighted to announce that a new and highly successful cancer treatment, CAR T-cell therapy, is now available in our province. And in August of last year, we announced that Alberta Health Services was establishing a CAR T-cell therapy program with funding from Alberta's government and the Alberta Cancer Foundation. The first Albertans received commercially manufactured CAR T-cell therapy just last month here at the Tom Baker Cancer Center. Now, on top of that, a Made in Alberta CAR T-cell therapy clinical trial has begun at the Cross Cancer Institute in Edmonton under the leadership of Dr. Michael Chu. And CAR T-cell therapy is used to treat certain types of leukemia and lymphoma in children and in adults. And this therapy is a critical part of the cancer care spectrum for use when conventional cancer treatments have been ineffective. And its success rate is remarkable. In U.S. clinical trials, as an example, about 50% of adults and 80% of children and young adults have experienced remission for more than 2 years. Previously, Albertans were only able to access this treatment in Ontario, or Quebec, or the United States. And capacity was limited, and long waits could be in the works for those folks who were looking for that type of treatment. So enabling Albertans to get this revolutionary treatment here, at home here in Alberta, will make a real difference. And it's another big step forward in cancer treatment here in Alberta, one of many in recent years. Survival rates are going up, and cancer treatment overall is one of the great success stories in medical science and in healthcare. But a cancer diagnosis is still a huge burden on every patient and every one of their families. So we need to keep driving research and driving treatment forward, and this is a day to celebrate another milestone. Providing this treatment in Alberta eliminates the need to travel outside of the province for care, an added burden on patients at any time, let alone in the middle of the pandemic. And it means that Alberta patients can stay closer to their homes, closer to their families, and the comfort and support that they need and need to have provided for them here in Alberta. And so we'll keep doing everything we can to prevent cancer and to treat it quickly, to treat it effectively. And I urge Albertans to see their physician immediately if they notice any physical changes and to not delay seeking medical care. Together, we can ensure that cancer is detected, it's detected sooner, and it's treated earlier. I'd now like to invite Wendy Bouchane, who's the CEO of the Alberta Cancer Foundation, to provide her remarks. And then after Wendy, we'll hear from Dr. Ted Braun and then from Dr. Mona Shafee as well. So thank you, and Wendy, I'll pass the mic to you.
Thank you, Minister, and good morning. You know, it doesn't seem like all that long ago that we were standing outside just on the other side of this building announcing a $15 million funding commitment to help make this exciting therapy available to Albertans. And here we are, just 6 or 7 months later, and Alberta Health Services already started treating patients, a few here in Calgary and a family in Edmonton. When you think of the difficult time faced in our community, and certainly by our health system, if not the most difficult time for our health system, that this innovation continue to move forward at this pace, well, it's just very encouraging. You know, COVID has canceled so many things, but unfortunately it didn't stop cancer. But I think what this shows us is it also didn't stop a commitment to research and innovation, and it certainly didn't stop a commitment to wanting to make sure cancer patients in this province have access to the very, very best. And this program is definitely an example of that. I also think this is a great example of the power of partnership and what you can do when you pair bright minds and extraordinary talent of people like Dr. Michael Chu and Dr. Mona Shafie together with a foundational funding commitment from the government with a dedicated group of community supporters and donors who simply want to make life better for Albertans facing cancer. The Alberta Cancer Foundation, along with our donors, are so pleased to be fundraising $5 million to support this program. And I think one of them says it best, Bill Sutherland, when he says, Dr. Chu is turning science into practical benefit. He's turning hope into reality, conducting innovative research right here in Alberta. I've seen firsthand what can happen when money is put into research, and now, with the work Dr. Chu and team are doing, we can catch up to what's happening in the rest of the world. Well, we couldn't agree more. So I'd like to thank the Alberta government. I want to congratulate Dr. Chu and Dr. Shafie and the whole team at Cancer Care Alberta for bringing this to life. And with that, I'm going to introduce Dr. Ted Braun. Ted is the VP and Medical Director of Clinical Operations for Alberta Health Services. Thank you.
Thank you, Wendy, and thank you, Minister Shandro. It is an honor to be here today. On behalf of Dr. Verna, you, the President and CEO of Alberta Health Services, and the entire executive team to share in this exciting announcement. Our cancer program in Alberta, as part of our integrated healthcare system, is one of the best in the country. I am so impressed with our cancer care teams and researchers for the advancement of cancer care options that continue to be made available to our province for our patients right here in our province. We are the only centre west of Ontario to offer commercial CAR-T therapy. In addition to the creation of a Made in Alberta trial that started only a few weeks ago. I am grateful we can offer this innovative treatment right here close to home. We're grateful for the very generous funding from our government and the Alberta Cancer Foundation. In just a few months since receiving that funding, our first patients are starting treatment. Patients who need this treatment because our other options have failed them. And that is quite an amazing accomplishment. It is not an easy road for these patients, but I'm encouraged that having CAR-T therapy close to home will help bring hope to our patients, their families, and their cancer journey, and should they ever need this option here in Alberta. I want to thank all of our partners for the continued collaboration and support for this program. Without you, Alberta's CAR-T cell therapy options could not have moved forward as quickly as they have. And now I'm very pleased to invite Dr. Mona Shafie, a hematologist here at the Tom Baker Centre who's leading CAR-T cell therapy treatment, to provide some remarks.
Thank you, Dr. Braun, and thank you, Wendy and Minister Shandro. More than a year ago, I was faced with telling a patient that the treatment meant to cure her lymphoma hadn't worked, and that there was nothing else I could offer that would give her any chance of recovery. She was expected to die from her cancer in the next 6 months. In Alberta, we did not have easy access to CAR T-cell therapy, but my patient, with the support of her family, traveled over the next few months to the U.S. to receive this treatment. This was no easy feat, especially because this was taking place during the COVID-19 pandemic. After she received her treatment, she was told for the first time since her diagnosis of cancer that she was in remission. I'm happy to report that she remains in remission today. This ignited a desire to pursue this treatment for all patients that needed this therapy, and preferably close to home. The groundwork for the future Alberta Cellular Therapy Program had already been laid out by my colleagues, Dr. Andrew Daly and Dr. Michael Chu. When we received funding, all hands were on deck to put things in place as fast as possible. I've been impressed by the commitment I've seen over the last 6 months to deliver the promise of this new therapy. In January, I had the privilege of accepting the first patient for standard of care treatment in Calgary. That patient is currently doing very well and has been discharged from hospital. I'm happy to report that the Made in Alberta clinical trial led by Dr. Michael Chu has also treated the first patient in Edmonton. This means that CAR T therapy is now available across our province, providing access for any Albertan that requires this treatment. This therapy is potentially curative in patients with very poor prognosis. It is being made available for all those that qualify. We expect the CAR T program to continue to grow over the next couple of years and more patients to receive this therapy as new indications are added. I want to say a huge thank you for the support we've received to date for this program. It has been tremendous, and we are excited about what the future will bring for cancer patients in Alberta. Thank you.
Okay, thank you, Dr. Shafee. Thank you to our previous speakers. We have time for 2 questions today, 1 and a follow-up. You can either ask the questions off the top or sequentially through the process. And we'll now go to the phone lines. Operator, could you please put through the first caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. This is for the Minister. Minister Chandro, are there any plans in Alberta to come up with a centralized booking system for pharmacy vaccinations?
Sorry, could you repeat the question? I was just in the back, so I wasn't able to hear the question.
Oh, sorry about that. I'm just wondering if there's a plan in Alberta to come up with a centralized booking system for COVID vaccinations at pharmacies.
Well, we do have, with the ministry and our relationship with the pharmacy, centralized scheduling or booking for the pharmacies to just schedule with us. I think that the Assistant Deputy Minister of Pharmaceutical, under whom the relationship with pharmacies is occurs, that he has those conversations with the pharmacies on an ongoing basis. Obviously, we will continue to make sure that our vaccine rollout is continuing to evolve and continuing to change. I don't think I can speak to whether or not that's in the works right now, but we continue to work with our pharmacies, get their feedback, as well as the feedback of Albertans and their experience in getting the vaccine either in the community from a physician or a pharmacy or in an NHS facility.
Carrie, do you have a follow-up?
Yeah, I do. With respect to Cargill, do you have any plans to try to get the mass vaccination clinic back on track prior to, sort of this next wave of Moderna shipments coming in? Is there any way to try to fast track that?
Well, and it's a good point, because the reason that it was postponed was because of the Moderna disruption. And of course, we want everyone included in 2C to continue to be a priority group. And so those folks are going to continue to be a priority. And as we have the vaccines, including Moderna, unfortunately, as you pointed out, the Moderna disruption was, I think, 65,000 doses of vaccines that didn't arrive as we were told they would. So we'll continue to keep those folks a priority in Phase 2C and making sure that we get those vaccines to them as quickly as possible, including it in that one location, and working with those physicians who had been working so well. And thank you to Dr. Weiss and Dr. Coakley for the work that they've been doing to organize that clinic. Thank you.
Operator, could you please put through the next question?
Janet French, CBC.
Hi there. Thanks for taking my question. This is for the minister. Dr. Teresa Tam said today that stringent restrictions adopted in some parts of Canada have slowed the spread of coronavirus, and she's urging provinces to keep restrictions in place until the summer to keep the pandemic manageable. And we've seen that provinces with tighter restrictions have slowed growth, but the trend in Alberta is still going up. R value last pegged at 1.09. So what do you plan to do to get Alberta's R value below 1?
Thanks, Janet. So we're continuing to look at the evidence, continuing to work with Dr. Hinshaw in her office. She has, as you probably know, about 15 folks in her office who are helping us to understand the data in Alberta and the extent to which further tightening restrictions might be needed in the rest of our response to the pandemic. We'll continue to work with her in her office, as well as the ministry, and to make sure that Emergency Management Cabinet Committee has the best information available to them to be able to make the decisions on whether further restrictions are required and how the easing of restrictions would be taking place as our vaccine rollout continues.
Janet, do you have a follow-up?
Yeah, I guess just to riff on that, I would question what is in your next considerable line of defense as far as restrictions go. And would travel restrictions that BC is acting on today, which are enforced, would that be among your list of things to consider?
Well, we don't right now have any options that are recommended to us by Dr. Hinshaw and her office. So as we continue to look at where there is community transmission and where there is growth and where there are concerns, and where further restrictions might be required, we'll continue to look at that evidence and look at that data and make sure that Emergency Management Cabinet Committee has that best available information and has those recommendations from Dr. Hinshaw.
Operator, could you put through the next caller?
Dean Bennett, Canadian Press.
Oh, good morning, Minister. My questions follow up kind of on Janet's. Because I think what Albertans are looking for today is, I mean, you're seeing the numbers. It's still going up despite the restrictions. So what's the plan? What's the next step? And you're saying that you're going to sort of look at the data and stuff, but where are you going with this? Where do you want to go? Are you going to focus on trying to fix it on the front end, i.e. more health restrictions? Are you going to try and hope that the vaccine kicks in and you can sort of keep the restrictions the way they are and maybe handle the extra cases in hospitals?
Well, Dean, maybe I'll go back to comments I made at the beginning of April, and maybe this even goes back to March, that we knew that this was going to be the storm before the calm, that as we went into a transition period, as the vaccine rollout continued, that we, as a province, worked incredibly hard in responding quickly to containing the variants. And that included the Border Pilot Project, which gave us the ability to be able to test the variants for 100% of those samples, those positive samples at the Border Pilot Project, even retroactively, so we could do everything we could to contain and mitigate the spread of the variants as we had disruptions in vaccine supply in February and March from the federal government. And it was a race between the vaccines and the variants. The variants have won. We have tightened restrictions as a consequence of that. If you're asking for specific tightening of restrictions, as I said to Janet's question, we don't have any of those recommendations right now from Dr. Henshaw, but we will continue to make sure that she has all the resources available to her to be able to make the right recommendations to Emergency Management Cabinet Committee and to me, and we'll continue to hear those recommendations from her when she comes forward with concerns that she might have about the community spread and what tightening of restrictions might be needed. But as we do see the vaccine rollout successfully being rolled out, now that we're having fewer disruptions, we're not seeing disruptions from Pfizer right now, which is good news. We've seen good uptake in the AstraZeneca vaccine. which is good news. And now we have 23% of Albertans who have had at least their first dose. We know as we have more vaccines going, then the cases will reduce. And as the cases reduce, then yes, the hospitalizations will reduce as well. But we do know that we might have concerning case growth, which we know that would be a concern for us in our hospitalizations. And so when we see that level of case growth that is concerning, or certain areas where we think that a tightening of restriction might be able to stop that type of spread, we're going to be getting that information and those recommendations to the Emergency Management Cabinet Committee at that time.
Dean, do you have a follow-up?
Yeah, just, is there a timeline, Minister? I mean, someone could make the argument with, almost 1,900 cases yesterday. What are you waiting for to do something? So, I mean, are you going to look at this on Monday? Are you going to make you keep saying you're going to wait for Hinshaw to give you some information, but should we be more proactive here and be deciding next week where we're going to go with this and how we're going to handle it?
Well, we're looking at where those cases are and where the spread is happening. And we knew that these were, by the way, I mean, these aren't the people who are identifying as positive today are people who, this is going back to the Easter long weekend. So this is a lot of times when people present as being positive, it's 2 or 3 weeks before they actually tested as positive that there was transmission. So we knew that this was going to happen. We made it very public that we were expecting, even after we tightened restrictions, that we were going for 2 or 3 weeks to be able to see continued increases in cases. So this is the evidence that we're looking and following, and making sure that that we're going to be making sure that any recommendations we would see from Dr. Hinshaw would be presented to Emergency Management Cabinet Committee at that time.
Okay, we have time for one more question. Operator, could you put through the next caller, please?
Francois Joly, CBC French.
Hi, this is a question for the Minister as well. Minister, we've heard Dr. Hinshaw over the last few weeks say many times that there is no specific source of spread of the virus. It's really happening all over Alberta and in various contexts. So are we already out of specific limited restriction that we can impose? Is the only thing left broader measures?
Well, broader measures, layered measures, as we saw in December, are a possibility, but that's going to depend on what the evidence shows. So we don't see that right now at this time. We do see perhaps in the coming weeks, if we don't see the tightening of restrictions that occurred a couple weeks ago, if we don't see that in leveling off and bringing down the R value, as Janet correctly pointed out, then maybe tightening of restrictions might be needed. But that's going to depend on that evidence we see at that time and the recommendations that Dr. Hinshaw brings forward to Emergency Management Committee.
Francois, do you have a follow-up?
Yes. So we're almost back to basically the same place we were in November and December. So what do you say to Albertans who made all those sacrificed Christmas? Was all of this pointless? We're pretty much back to where we were a couple months ago.
No. None of that was pointless, Francois. Look, I mean, let me say this, that the Albertans have made great sacrifices, as people throughout the rest of the world have as well. And we've seen, the restrictions that other jurisdictions have also had, as well as Alberta, in times that they were implemented in being able to help us reduce spread of COVID in our communities. And we know that there are going to be waves, and the waves are going to ebb and they're going to flow. And we've seen that in every other jurisdiction throughout the rest of the world. That's not to say that previous restrictions and previous sacrifices were for nothing. It's the exact opposite. They were very important measures and thank you to all the Albertans who complied with those measures in November, December, January, up until now. And continuing to make sacrifices to limit spread. Let's remember that Albertans are right now there are sacrifices being made right now, and we had further tightening of restrictions that were announced weeks ago. And thank you to all those Albertans for making those sacrifices. It is making a difference. And if they weren't making that difference, then we would see extraordinary growth in the variants right now in Alberta if we didn't have folks complying. So thank you to all those Albertans who are doing that.
Okay, thank you very much for joining us today.